Hi there, my name is Dr. Lori Brotto. I'm a professor of obstetrics and gynecology at the University of British Columbia and a registered psychologist in Vancouver, Canada, and co-creator of eSense.
And I'm Dr. Kyle Stephenson, Associate Professor at Xavier University, licensed clinical psychologist, and co-creator of eSense.
We're here to introduce eSense, why we created it, the science behind it, and the difference it's making in women's sexual health.
And to share results that show why you can feel confident recommending eSense to your patients, because it delivers the same type of support they would get in a clinic, but in a way that's private, affordable, and accessible to more women.
Large population-based studies show that sexual concerns, especially low desire and arousal, are extremely common. These issues aren't just about sex. They create emotional distress, strained relationships, and are linked to anxiety, depression, and overall reduced quality of life. In fact, it's been found that nearly half of women experience sexual difficulties at some point in their lives. We see it across ages, across cultures, and even at different life stages, like in the postpartum, peri and postmenopause, and even among cancer survivors. Yet, despite how widespread the problem is, very few women get help. Why? There are many reasons for this gap in care. Most medical school training for healthcare professionals barely touches on women's sexual health. Geography, cost, and lack of trained providers make care hard to reach. Sadly, there continues to be ongoing stigma, shame, and embarrassment that impede a lot of women from even talking to a healthcare provider in the first place. The small minority of women who do speak up often report being dismissed, being told that the problem is all in their head or to go home and just have a glass of wine, which minimizes their concerns and ignores the underlying causes. So, to address these barriers, Dr. Stephenson and I created eSense with one mission to empower all women, regardless of identity, background, or location, to take control of their sexual well being through accessible, evidence based support.
And our goal was to translate the same treatments that work in our clinics, specifically cognitive behavioral therapy and mindfulness-based therapy, and deliver them digitally so women can access them anytime, anywhere. The program is self-directed with 8 modules per treatment arm. Women can move at their own pace, and those who want extra support can work with trained navigators who offer encouragement and answer questions. And this approach dramatically reduces cost barriers while still delivering a structured therapeutic experience. And importantly, eSense isn't just educational content. It's built around interactive, evidence-based experiences and layered with real-world examples based on women we've treated in our own practices. We've purposely made eSense as inclusive as possible. It's appropriate for women of any age, cultural background, or sexual orientation. As long as they have distressing sexual problems, can access the program, can navigate a website, and are fluent in English, eSense can help. The images on this slide show 3 fictional women that are followed throughout the program. As each of the women works through their issues, users can see how the different exercises can be put into practice in the real world. And this process took a fair amount of time. Since we began work in 2016, it's been almost a decade of effort to bring an effective, evidence-based program to life. A number of feasibility studies allowed us to iterate eSense until we reached a version that was ready to test on a larger scale. And as scientists, clinicians, and advocates for women's health, it's been important for us to work with patient partners at each step of the way and to submit our findings to high-impact, peer-reviewed scientific journals. Here you can see some visual examples of the program. We've been fortunate to work with an amazing team of artists and web designers to create a program that's highly engaging and easy to use. And in our most comprehensive study, it was a randomized controlled trial with 129 women diagnosed with sexual interest and arousal disorder. Participants were randomized to CBT, mindfulness, or waitlist control. And we knew that it would be potentially difficult to complete such a challenging program, so we also matched women with treatment navigators. And these were students who received training and supervision in active listening and in the content of eSense. They were able to demonstrate empathic understanding, answer practical questions, and provide accountability. We spent a lot of time on this system recruiting, training, and evaluating navigators as a way to provide human support to the women that want it while keeping costs affordable. And it's also a great opportunity for students to take their first steps towards becoming expert providers themselves. Our participants in the study ranged widely in age, the average being in their early 40s. Most were in long-term relationships. Only 13% had received prior treatment for sexual concerns, and 17% were on menopausal hormone therapy. Importantly, half of the sample reported a history of sexual assault, which allowed us to test whether this history made it more difficult to use eSense and whether these women benefited from their experiences with the program. We assessed women before, during, and after using eSense to make sure any positive effects didn't fade after completion. And we were happy to see a low attrition rate of 20%, which is much lower than the dropout rate that we often see in digital health programs. And we think this speaks to the program's ease of use and the relevance of the content.
So now let's talk about the results because this is where eSense really shines. We saw large improvements in sexual desire and arousal for women in both the CBT and mindfulness arms when compared to the waitlist control group. These changes were not only statistically significant, but also clinically meaningful. In case you're not familiar with Cohen's d effect sizes, the 0.9 to 1.13 numbers are quite large and represent the kind of improvement one would hope to see with high quality in-person therapy. Similarly, when we looked at reductions in sex-related distress, women in both the CBT and mindfulness arms saw statistically and very meaningful improvements in their reductions in distress compared to those in the control group. Secondary outcomes included looking at improvements in sexual satisfaction, where we saw very parallel findings. This is women self-reporting how satisfied they were with the sexual aspect of their relationship. And we also looked at overall sexual function, which is a global measure that includes orgasm, intensity of genital pain, as well as sexual desire, arousal, and satisfaction. And again, we saw significant and quite meaningful improvements that were significantly different from the control group with very high effect sizes. For all of these outcomes that you're seeing, the gains were maintained at a 6-month follow-up time point, showing that women continued to benefit long after completing eSense. As mentioned previously, we compared women with and without a history of sexual assault, whether it took place as a child or as an adult. This is often a concern because trauma can make sexual interventions more challenging. But in our trial, these women improved at the same rate, reported equal satisfaction, and stayed in the program just as long as those without a history of sexual assault. This is a really exciting finding, as we know a common consequence of sexual assault is a tendency to be afraid of sex or to avoid it altogether. Looking at sexual distress in these same two groups, you can see that we have very similar results, the same magnitude of improvement, regardless of whether there was a history of sexual assault. We also tracked their level of post-traumatic stress disorder, or PTSD symptoms for short. And even though eSense does not directly treat PTSD, we saw a significant reduction in PTSD symptoms for women with a trauma history, likely because the program helped them re-engage with sexual experiences in a safe and structured way.
And in addition to these improvements in validated scales of clinical outcomes, we also saw high ratings for usability. Women described eSense as easy to navigate and helpful, and they were satisfied with their overall experience. And we're now building on these promising results. We've begun adapting eSense for specific groups of women that have high rates of sexual dysfunction, including gynecologic and breast cancer survivors, transgender women, women with pelvic floor disorders, and those with chronic genital pain known as vulvodynia. In addition, we continue to test eSense with other populations of women, including with PCOS or polycystic ovary syndrome, neurodiverse women, including those with ADHD or autism, and gender diverse women. Each adaptation keeps the evidence-based foundation while making small changes to ensure cultural and clinical relevance. For providers, this means that eSense can be a safe, effective referral option, not just for your average patient, but for women with a wide range of backgrounds and medical histories, many of whom may otherwise have nowhere to turn.
So thank you for taking the time to learn about eSense. We've built it to remove the barriers that keep women from getting help while keeping the gold standard therapies that work. For your patients, this means that they can get confidential, flexible, and effective care. And for you, it means that you can feel confident referring them to a program backed by rigorous science and real-world results. We hope you'll join us on our mission to redefine women's sexual health care.